Now let's move on to the gastroenterology or just GI system. So what do we have here? We have here is an advocate who was shot dead beside a stool. Yes, stool. That's for sitting. And the reports also say that the name of the advocate was Jamal Pandu. Yeah, I know it's a made up name. Sounds fake, but okay. Anyway, now what are we going to discuss in this scenario is appetite, dysphagia, vomiting or hematemesis under the same heading, jaundice, dyspepsia, edema, ascites, distension of abdomen, and stools in detail. That include constipation, diarrhea, flatus, melena, and so and so. Sit tight and get ready because we embark on a journey to investigate who shot our advocate Jamal Pandu dead beside stools. So while we arrive at the crime scene, we find what? What is this? It's a machine? It's a tanker? Or what is it? Well, we don't know what is it. We just call it machine. And I think this thing shot our advocate dead. So to know more about this machine, we just fill up the colors. Now we know that there are two input terminals on the top, while there are three different output terminals at the bottom. And this is just resembling our GIT system. You know, just like you eat things, your stomach processes things, and then you just defecate them out. So let's crack this thing down, shall we? So one of the input terminals is going to represent dysphagia, and the other input terminal is going to represent about the vomiting or hematemesis. I know it's an input terminal, but when things go wrong, the output starts coming out of the input channel. So if we talk about the dysphagia, which is the first input channel, dysphagia simply means difficulty in swallowing. Now, different causes are there. There are oropharyngeal causes, esophageal causes, and functional, which is known as globus hystericus. Now, this sudden onset is very important. This is significantly related to the foreign body impaction. Then it's very important to ask about the nature of dysphagia. For example, it could be progressive or non-progressive. If it's progressive, the patient is going to complain that they started dysphagia with solids, then they shifted to the semi-solids, and now they're at liquids, and now they can't even take liquids. And it's just getting worse with the passage of time. This is because of carcinoma of esophagus or peritonsillar abscess, which is also known as quinsy, or bulbar palsy, or just pseudobulbar palsy. Then you're going to ask the patient, what is your problem? What's wrong with you? Yes, you're really going to ask it. You will ask them where the food seems to stick. Now, if they say behind the mouth or throat, that's because of tonsillitis or quinsy, or if they say behind the cricoid cartilage, that could be because of stricture or esophagus or Plummer-Wilson syndrome, or could be neuromuscular disorder, for example, pseudobulbar palsy or palsy. And if they say that the food sticks behind the sternum, that could be because of stricture or peptic esophagitis or just achalasia. Then you're really going to investigate about the type of food. If the dysphagia is with a solid food, that is because of stricture or growth of esophagus or foreign body, achalasia, or peptic esophagitis. And if the patient says they cannot take liquid, that is because of neurological or neuromuscular disease. Now, if they say they have a feeling of lump in the throat and they have it checked multiple times but there's really nothing, that's globus hystericus. Next, you're going to ask if it's painful or painless dysphagia. If it's painful dysphagia, that is because of tonsillitis, peritonsillar abscess, which is quinsy or just peptic esophagitis. Finally, you're going to ask about the progression. If it's intermittent, that's because of myasthenia. If it's not changing over the years, that's because of achalasia or Plummer-Wilson syndrome. And if it's getting worse within weeks, that's because of carcinoma esophagus. If it's getting worse within months, that's because of benign stricture. And if it's getting worse in few days, that's because of bulbar or pseudobulbar palsy. Now that's enough lecture on dysphagia. Let's move on to the associated symptoms. First of all, we have heartburn. That is represented by the burning cannon input. Now, if the patient has heartburn, or you can say retrosternal burning along with dysphagia, that is most likely because of peptic esophagitis. Next, what we have here is a red handkerchief that is hanging with a pole. And this red handkerchief used to be our symbol for sore throat. Now, if there's a patient with a sore throat, fever, and dysphagia, that is most likely because of acute tonsillitis or peritonsillar abscess, which is quinsy. Next, this machine has also two security cameras, and one of the cameras is just down. And that is representing drooping of the eyelids. When there's drooping of the eyelids along with dysphagia, this is going to be myasthenia gravis. And the patient is going to tell you that in the beginning of the day, everything is fine. As soon as the day passes, they get symptoms. Next, we have another advocate who came here for the inquiry of the death of Jamal Pandu, and his name is Kamal Pandu. You know one thing about Kamal Pandu? He's having a flame bandana, which is going to represent fever. So our advocate is with the fever. Now that is really going to tell you about acute tonsillitis and peritonsillar abscess if they are associated with sore throat as well. If there's no sore throat, just fever and dysphagia, that is most likely because of carcinoma. Looks like Kamal Pandu found the culprit and hanged him till death. And the culprit is just like he's having slurred speech. So slurred speech that he can't even ask for help? Bro, even if you ask for help, it's useless now. So when there are complaints of nasal regurgitation of fluids, choking, slurred speech, that is because of neuromuscular diseases, for example, bulbar palsy or pseudobulbar palsy. Next we have is a skinned lion, and that skinned lion is going to tell you about the tightening of the skin as seen in scleroderma or the Raynaud's phenomena. So if there's dysphagia with the tightening of skin, that is Raynaud's or scleroderma. So now to make sure that the gallows stay at their place and don't get displaced, we add some weight. Now in this case, this is weight loss with an arrow going downward. When there's weight loss with dysphagia, that is because of malignancy or any other significant obstruction. You know, fun fact about this culprit? Before he was hanged to death, his hands were secured with the handcuffs. So these cuffs are very important, just like the combination of dysphagia and cough. Now if there's recurrent cough, that can cause aspiration pneumonia. Next, to add more to this dysphagia, we can always go to the Appetite App Store. To find out more, head over to our Appetite App Store main factory outlet and the constitutional symptom segment. Now, if the appetite is reduced with dysphagia, that could be because of carcinoma of esophagus. Next, we come back to our advocate, and while he looks at the machine, he's just so surprised and he's like, the what? That is called the real anxiety. Now, if there is dysphagia with anxiety or depression, that is because of globus hystericus, and the patient is constantly telling you that there is something in their throat while they already spent a lot of money in their checkups and they have got it checked multiple times, but there's nothing, but they're still complaining something is stuck behind the throat. And that's all about dysphagia. Just one more thing, ask about the past history of suicidal attempts with corrosives, as the corrosives can really form strictures. Next up, let's explore the second input terminal. Is the terminal when things go really wrong and start coming out. So it's no longer an input terminal. That's vomiting. So if we just talk about vomiting, it has a lot of causes. For example, gastroenteritis, peptic ulcer, viral hepatitis. We can have endocrinological disorders, for example, Addison's disease, diabetes, where the patient presents in the diabetic ketoacidosis. We can have vomiting in pregnancy, obstructive lesions, for example, pyloric stenosis, intestinal obstruction, paralytic ileus, psychogenic vomiting. We can also have drugs that cause vomiting, for example, digoxin, iron, potassium chloride, opiates, estrogens, and bronchodilators. And we can have other different causes, for example, Meniere's disease, intracranial pressure, migraines, colics that include renal colic, biliary colic, intestinal colic, or any other febrile illness. Now, when you see a patient with vomiting, you're going to ask about the frequency, how many times in 24 hours. Then you're going to ask if it's projectile or non-projectile. The only thing that differentiates between these two types is nausea. The projectile vomiting is seen in intracranial pressure and pyloric stenosis. Then you will ask about the timing of vomiting. If it's early morning, that could be because of pregnancy, alcoholism, uremia, chronic bronchitis, and sometimes psychogenic vomiting. Now, one more important thing is relation to the meals. Now, if it's immediately after the meals, that's because of anorexia nervosa or something just can be wrong with the throat. If the patient just vomits half hour after taking meal, that's because of peptic ulcer, and if there's no relation to the meal, that is because of endocrine disorders. else are you going to ask in a patient with vomiting? Well, you have to ask about the contents. They really tell you a lot about what's going on. If there are food particles eaten up to 2 hours ago, that's because of gastritis, gastroenteritis, peptic ulcer, or endocrinological disorders. If they're partially digested food eaten up to 24 hours, that's because of pyloric stenosis and small intestinal obstruction. We'll ask about the color of the vomitus. Now, if the vomitus is yellow, that's because of HCl and seen in pyloric stenosis or obstructive jaundice. If it's greenish, it is containing bile. And if it's coffee ground, that is just hematemesis, and it could be because of ruptured esophageal varices, bleeding peptic ulcer, which is the most common cause, gastric erosion, gastric carcinoma, uremia, and sometimes bleeding disorders. And then you're going to ask about the smell. If it's just normal vomitus smell, that's normal. If there's smell of some fecal material, that's because of fistula or paralytic ileus. If it's putrid, that's because of bacterial overgrowth seen in fungating gastric carcinoma. And now, please, that's enough of the lecture. Let's just go with the associated symptoms. Can we just stop here? First associated symptom of vomiting is pain. You have to ask the patient if they have any pain in the right hypochondrial region or just burning or cutting epigastrium pain or anywhere pain in the abdomen. And to remind you of the pain were peptic ulcer. Next, we can also ask the patient about the history of jaundice. If it's positive, that's because of viral hepatitis or acute cholecystitis or pancreatitis. Now remember, this jaundice vomiting can also be associated with the pain in the right hypochondrial region. Let's see what else this machine is having for us. She's having an injured hanging kidney with a bow tie. So that means chronic renal failure can also present as vomiting. That's because of hyperuricemia. And sometimes thyrotoxicosis can also present as vomiting. However, this is not a main presenting complaint. What is it? It's just gunk coming out of this machine? Or is it just diarrhea? Yes, it looks like diarrhea. There's vomiting and diarrhea, that is because of viral gastroenteritis or bacterial gastroenteritis, also seen as diabetic ketoacidosis. We just call it diabetic diarrhea. And sometimes in Addison's disease, we also get the diarrhea. To help you remember the causes of diarrhea besides bacterial or viral gastroenteritis, we're just drawing this jar of sugar candies along with this Addison logo, which is Addison's disease. Now, as you can see in the second input terminal, there is a secondary pipe that is just obstructed or constipated or blocked, whatever is it. So there's obstruction and blocking. Now, if there's constipation, there is vomiting. What are the causes of constipation? Well, hypercalcemia and intestinal obstruction can cause constipation, and constipation can ultimately cause vomiting. And now we're drying this lady and she's pregnant? What? Anyway, she's trying to look the machine from the other side, and guess what? She's just looking at the machine and she's not listening to the machine. She's just wearing those red headphones. It means something is wrong with the ear. Either it's deafness or attacks of vertigo, as seen in the Meniere's disease. So in the Meniere's disease, you get deafness and vertigo along with vomiting. And that's all about vomiting. Just one more thing, ask about the aggravating factor. If they say they feel bad after eating spicy food, that's because of peptic ulcer. And if they say they cannot eat meat or chicken, that's because of carcinoma of stomach. And if they are emotionally upset, that's psychogenic vomiting. And of course, the relieving factors are going to be milk or antacids or the sucralfates or something like that. So that's all about vomiting. Now let's talk about hematemesis, which is just blood in the vomitus. Now this hematemesis has many common causes. For example, esophageal varices, gastric erosions, Mallory syndrome, Boerhaave syndrome, or we can have peptic ulcer, gastric carcinoma, and bleeding disorders. Now one thing you'll do about hematemesis is just ask the color of the vomitus. If it's dark red or coffee ground, that's because of slow bleeding. If it's bright red, that's because of recent bleeding or massive bleeding. And you can also ask about the quantity of blood. Ask about NSAIDs, steroids, alcohol, or previous history of jaundice or ascites that can lead you to liver cirrhosis. And to talk about the associated symptoms, we have anemia and jaundice. Now, this anemia is represented by these red signals that suspiciously look like RBCs. And for the jaundice, we give yellow paint to the posterior part of this machine. Now, if the patient is anemic, he's going to come with the complaints of palpitations, shortness of breath, fatigue, headache, and so and so. And if the patient is with jaundice, ask about ascites, appetite, lymphadenopathy, fever, rigors, and pain in right hypochondrium. Okay, so besides anemia and jaundice, what else are you going to ask the patient? Well, you're going to ask about the heartburn. So I'm going to represent the heartburn by this flamey butt of the machine. Well, really? Uh, your heart lies in your butt? Anyway, it's heartburn. Now, when you get heartburn with hematemesis, this is peptic ulcer disease, the most common cause of hematemesis. Now you see there's a lot of water coming out of this machine. It's the fluid overload. So ask about the ascites in a patient with hematemesis. These are the just patients of DCLD. And to learn more about edema and ascites, head over to the ascites water tank in the cardiology section. Wait. This machine can also bleed. Is that blood coming out or some chemical toxin? I don't know. Seems like blood to me. So, in the patient of hematemesis and melena, keep bleeding disorders or bleeding diatheses under your differential. Ask about a history of gum bleed, nose bleed, skin bleed, petechiae, rashes, or something like that. And if that's from childhood, it's surely going to be some hereditary disease. Next, we draw this bald man who's just hanging around the dead body of our advocate Jamal Pandu. I think you're the culprit. And as you know, this is very suspicious, so he's surely hiding something under his cap or under these elastic bandages around his abdomen. I know, baby, there's something fishy about you, and you just can't escape. What? You get arthralgia as well? Now, if we talk about the abdominal pain, that's in the left hypochondrium, and that is seen in the patient with cirrhosis. Now we're left with two more pains, that is headache, pain in head, and joint ache, that is arthritis. Now, there's no direct relation of hematemesis with headache or arthritis or joint pains, but this is just an indirect way of asking your patient if they are taking some potent NSAIDs, which can cause gastric erosion and hematemesis. However, joint pain is an exception to this rule and can be seen in the patients with hemophilia and they present with hemarthrosis. Oh my god, look what this suspicious man found. He found skull with broken bones around. Now these round broken bones suspiciously look like lymph nodes. So ask your patient if they appreciate some nodules in the cervical, groin or axillary region. These are actually lymph nodes. And what about bones? These bones are going to represent bone pains for which our patient is chronically taking NSAIDs. So this is just an indirect way of asking drug abuse. You know why these bones are crushed into round pieces? That's because something heavy fell on it, and that's weight. And to be more specific, a weight with an arrow going downward, which is weight loss. If there's hematemesis and weight loss, better think about gastric carcinoma. What else are you going to find? You'll find anorexia and asthenia as well. So if you see weight loss, anorexia, asthenia, and hematemesis, go for gastric carcinoma. Now it's time to draw a scarecrow. And it's not just a simple scarecrow, it's a jaundiced scarecrow. This scarecrow is wearing a yellow coat that is going to represent jaundice. And to add more to the scarecrow is fastened by the use of elastic bandages from left and right sides. So that is going to represent the pain in right hypochondrium and pain in left hypochondrium. Now the whole story is very simple. If there's jaundice and pain in right upper quadrant, that is either because of liver or because of the hepatobiliary tree. Now, the liver causes include viral hepatitis or drug-induced hepatitis, and the pain is colicky. That is because of choledocholithiasis. Or if there's jaundice with the pain in the left upper abdomen, that is because of cirrhosis of liver or hemolytic jaundice. Now, to talk about the jaundice, we get prehepatic, hepatic, and posthepatic. Prehepatic are the hemolytic causes, for example, autoimmune, thalassemia, glucose 6 phosphate dehydrogenase deficiency, or blood transfusion. The hepatic causes include viral hepatitis, toxic hepatitis, infiltrative diseases, for example, Wilson disease, hemochromatosis, or congenital hyperbilirubinemias, for example, Gilbert syndrome, Dubin-Johnson syndrome, or Rhodes syndrome. And if we talk about the posthepatic causes, we get the choledocholithiasis, cholangitis, cholestasis, and malignancies, for example, the carcinoma of head of pancreas or carcinoma of ampoule of Weber, etc., etc. Now, if you see a patient with jaundice, what are you going to do? You're going to ask the duration. If it's long-standing for years or just recent. If it's for years, it's because of familial hyperbilirubinemias, and if it's recent, that's because of infection or toxic hepatitis or just hemolytic jaundice and obstructive jaundice. Next, you're going to ask about the onset. If it's sudden, that's because of hemolysis or a sudden stone impaction in the bile duct. And if it's gradual, that's because of infective diseases or just drug-induced hepatitis. Next thing is to ask about the colors of poop and pee. Now, the urine is going to get dark in all types of jaundice, while the color of stool changes to clay color in just obstructive jaundice. Next, we draw again an appetite app store, and this time near this jaundice scarecrow. So this means when you see a patient with jaundice, must ask about their appetite. To learn more about this appetite app store, head over to our constitutional symptom segment where the factory outlet of appetite app store is present. Just as a refresher, an appetite can have different flavors. For example, it's poor, it's intermittent, or it's progressive. If the appetite is poor with the jaundice, that's because of viral hepatitis or drug-induced hepatitis. Now, if the appetite is intermittent, that is seen in hemolytic crisis, or if there is a stone in CBD, or just in the carcinoma of ampulla of Vater. And if the appetite is progressively decreasing, that's seen in the carcinoma of head of pancreas. So these are the relations of different flavors of appetite with the jaundice. That's a lot of detail about appetite and jaundice. I wish I could burn this whole thing to hell. Oh my god, oh my god, oh my god, there is fire. Burn in hell. Everything is on fire. It means fever. Now, this fever can have different combination with the jaundice. For example, if there's first fever followed by jaundice, that's because of viral hepatitis. Or if there's intermittent fever with rigors during the period of jaundice, this is cholangitis. Or if there's fever with rigors at the onset of jaundice, this is hemolytic jaundice. Oh my god, the fire is catching almost everything, including that tiny little duck. And what about her eggs? Well, this is not a duck, this is just a swan, and it's a swan from that toxic pond in the constitutional symptom segment. And this duck is here to remind you that you must ask about the rigors with the fever. You know the other causes of rigors? Toxemia, septicemia, and malaria. Well, that swan is right from that toxic pond. And you see her eggs? These eggs are suspiciously looking like lymph nodes. These lymph nodes are going to represent the carcinoma of head of pancreas, or ampulla of Vater, or just carcinoma of CBD. Now that was all about jaundice. As a quick recap, you're going to ask about pain in right hypochondrium or left hypochondrium region, or fever or rigors or appetite or lymph nodes. Next, we're going to talk about abdominal distension, and we're going to represent this with a distended tent that looks like abdomen. Now, this distended tent is supported by 4 different weights. So, in a distended abdomen, you're going to ask about weight loss. And one more thing, this abdominal distension is quite different from ascites. Now, ascites is just fluid, and abdominal distension is a big category. It can have other different causes, including ascites. Now, it can have obesity, pregnancy, ascites, intestinal obstruction, or ovarian cyst. So we have different Fs. F for fat, F for fetus, F for fluid, F for flatus and feces, and F for fibroid. Now, if you see a patient with abdominal distension, you're going to ask about the onset. If it's sudden, it's acute intestinal obstruction. You'll ask about the progression. If it's localized, it could be pregnancy, it could be intestinal obstruction, intestinal TB, malignant ascites, or ovarian cyst. If it's starting from abdomen and progressing to legs, that's because of cirrhosis. If it starts from legs and moves to the abdomen, that's congestive cardiac failure. And if it starts from the lower eyelids and face and causes puffiness, including complaints of puffiness of face when the person wakes up, and this progresses from face to the abdomen and feet, that's because of nephrotic syndrome. Next, you'll ask about pain. If it's painful, it's intestinal obstruction or pyogenic infection, or it could be tuberculous ascites or malignant infiltration. If painless, could be obesity, pregnancy, ovarian cyst, or some transudative ascites, for example, ascites because of liver, kidney, or heart. Next, as we already discussed about the weight loss, if there's weight loss and abdominal distension, along with change in bowel habits, that's because of malignant ascites due to GIT malignancy. One more thing you'll learn about this tent is that it has an outlet, and that is obstructive. That's why we have colored it in red. Now this red outlet is going to represent the absolute constipation and intestinal obstruction. So we're really going to see the features of intestinal obstruction that include vomiting, pain in abdomen, absolute constipation, inability to pass the flatus, and abdominal pain. Next, beside this distended tent, someone has enjoyed a lot of these colored drinks and just thrown away these Pepsi cans around. Seriously, that's very bad. Anyway, these Pepsi cans are going to tell you about dyspepsia. Now, if there's dyspepsia along with abdominal distension, that is perforated ulcer. See what we got. Just like the last time, another scarecrow, and that one is also in yellow, which means jaundice. And again, just like the last time, it's also fastened with elastic bandages on the right and left side, which is just going to tell you about the pain in left hypochondrium region or the pain in right hypochondrium region. Now, if there's jaundice and abdominal distension, it's a liver cirrhosis. Now, if there's pain in the left hypochondrium region along with abdominal distension, this is splenomegaly because of, again, liver cirrhosis. And for the pain in right hypochondrium region and abdominal distension, it is liver itself. Oh no, just like the last time, this tent is again on fire. Burn in hell. This fire is going to represent the fever. If there's abdominal distension with fever, that could be because of tuberculous ascites or peritonitis. And you know what? Because of the fire, the lady has come out of the tent. Actually, it's not just a lady, it's a lady plus a baby. You know that? She's just carrying two lives at one time. So that lady is just pregnant. Must rule out pregnancy when you see abdominal distension. This is generally a young lady who complains of this gradual painless abdominal distension starting from lower abdomen associated with amenorrhea, morning sickness, and fetal movements. And now when the tent burns, this lady just comes out, saves two lives, and is looking at her own tummy and see if the child is really fine. You're going to be a beautiful mother, just beautiful as your necklace. And you know what? This beautiful necklace is suspiciously looking like lymph nodes. So if a patient comes with abdominal distension and lymphadenopathy, better think of some carcinoma or just malignant infiltration. Then we draw a pad, and this pad is going to tell you about amenorrhea. If there's amenorrhea with the abdominal distension, could be pregnancy, could be ovarian cyst, which is also known as Meek syndrome, and sometimes it's also seen in tuberculous ascites, cirrhosis, or just nephrotic syndrome. Next, we draw this edematous water tank to represent edema, and to know more about edema, head over to our cardiology section to learn more. Next, there is a Pepsi truck, and the driver is just trying to deliver the Pepsis to the outlet. And you know what? For the promotion of the brand, we also got here a hot air Pepsi balloon. Now, this Pepsi is going to represent dyspepsia, which is just discomfort in the upper abdomen, could be associated with flatulence, heartburn, nausea, vomiting, and the common causes include ulcers, could be gastric or duodenal, IBS, chronic cholecystitis, chronic pancreatitis, or just appendicitis or gastric carcinoma. Now, when the person says there's a discomfort in the upper abdomen, better start taking the history of a pain. You have to cover onset, duration, intensity, progression, associated factors, aggravating factors, and relieving factors, along with corrector, radiation, relationship to food, timing of pain, and periodicity. If it's epigastrium or left hypochondrium, it's gastric ulcer. If it's the right part of epigastrium, that's duodenal ulcer. If it's right iliac fossa, that's appendicitis. If it's right hypochondrium, that is chronic cholecystitis. If it's diffuse over the whole abdomen, that's because of non-ulcer dyspepsia or irritable bowel syndrome. Then you'll ask about the corrector of the pain. If it's cutting or burning, that's simply peptic ulcer. If it's colicky, that's because of chronic cholecystitis or just appendicitis. If it's dull, this is pancreatitis, and the patient is going to present in Mohammedan's prayers position. Now, if the pain radiates towards the right shoulder, right scapula, or interscapular region, this is going to be biliary colic or chronic cholecystitis. If it's penetrates through the back, this is perforated duodenal ulcer or just pancreatitis. If the pain is at McBurney sign, this is appendicitis. If the food causes pain, this is gastric ulcer. If the food relieves pain, this is duodenal ulcer. If there is no relation, this is non-ulcer dyspepsia. Now, just like this relationship with the food, timing is also very important. If the pain occurs half hour after meal, it's gastric ulcer. 1.5 hour after meal, this is duodenal ulcer. Pain in early morning when the stomach is empty, that's duodenal ulcer. And if there's constant pain, and that pain increases with meals, this is gastric carcinoma or just penetrating peptic ulcer. If there's just no definite relationship of timing of pain to the meals, that's seen in chronic cholecystitis, chronic pancreatitis, or appendicitis. Now, one more thing about peptic ulcer is that there's periodicity. In the peptic ulcer, you get episodes, each lasting from 7 to 14 days and 2 to 6 times a year. Okay, so enough of this lecture. Let's move on to the hot air balloon. Now, when you see this hot air balloon, you see it's already tied with a weight. And that's the symbol for weight loss. That's because of gastric carcinoma and sometimes in peptic ulcer. Then you'll also notice that this balloon is on fire. That fire is actually heartburn, and if there's dyspepsia with a heartburn, this is reflux esophagitis or peptic ulcer. Wait, emergency, emergency, it's an ambush. The skeleton dead army has attacked the Pepsi balloon and the Pepsi truck. Help! You know what? The skeleton is trying to hijack a hot air balloon. Whoa, man, what a choice. And as you can see, the skeleton took excitement to the next level and got this balloon punctured. Stupid man, you're just digging your own grave. Oh, wait. I forgot. You're already, dead, right? So this air coming out of balloon is just flatus. Now, if there is passage of flatus with blanching and blotting and dyspepsia, this is going to represent non-ulcer dyspepsia, chronic cholecystitis, chronic pancreatitis, appendicitis, and peptic ulcer. You know, after making a punch hole in balloon, the skeleton is now just sad, cursing himself, thinking about life decision, life choices. Oh my god, why am I here? I should die for the second time as well. Now he's taking anxiety and depression very seriously. So just like that, if there's dyspepsia with depression or anxiety and with morning nausea without any significant weight loss, this is non-ulcer or just functional dyspepsia. Oh my god, the ambush is real. The truck has been hijacked. It's the skeletal army. And you can see I've drawn the main leader of the skeleton army onto the bonnet of the truck, and he's with a flag and a beautiful shield. This shield has a beautiful alternating pattern, black and white, just like alternating diarrhea with constipation. So if there's dyspepsia along with constipation alternating with diarrhea and scanty stools containing mucus, this is IBS. That's okay, but what about the flag? What does the flag mean? Well, for your information, the flag has skull and bones and just crushed bones that look like lymph nodes. So you're going to ask about bone pains and lymph nodes. Now, the lymphadenopathy is because of the gastric carcinoma, and the bones, they're just an indirect way of asking the patient if they're taking any NSAIDs. And finally, one of the skeletons from the skeletal army was missing, and he's just here. He's jumping into the truck to steal some drinks. And now if you look at the stool, you realize this is a yellow stool. And a yellow stool stands for steatorrhea. Now it's time to go back to our advocate who was shot dead beside the stool. One thing you'll see is that this big, giant, weird machine, yes, it has 3 different output terminals. One of the terminals is just releasing black toxic gas along with these black stools. So the first output terminal is going to represent melena. The second output terminal is going to represent diarrhea, and the third output terminal is going to represent constipation. These stools are really tarry, sticky, and semi-solids, just like this black gas coming out of first output terminal of the machine. Now, this melena is really associated with hematemesis, and just like all other diseases, we can always talk about associated symptoms with the melena. First up, I'm going to draw a lot of blood because our advocate was shot dead and he's bleeding so badly. And then you'll realize there's something coming out of blood that looks like red blood cells or something. Oh yes, that's anemia. So in a patient with complaints of melena, you're going to keep bleeding diathesis in the back of your mind, and you're also going to ask about the symptoms of anemia. For example, palpitation, tachycardia, myalgias. One more pro tip. While you go for bleeding disorders, ask the patient if they appreciate any bleed from the gums, nose, skin, or do they have petechiae or rashes or something like that. Then we're going to give this advocate an elastic bandage on its knee joint that is indicative of arthritis. Now, this arthritis is just an indirect way of asking the patient if they're taking any NSAIDs. You know, one more fun fact about our advocate Jamal Panda. He was just dragged out of his tent and shot in an open ground. So here we draw another tent. This is going to represent the distended abdomen, and this tent is supported by 4 different weights, which are going to represent weight loss. Next up, we draw the wife of Jamal Pandu. This is Jamila Pandey. She has just come to know about the death of her husband. Ah, pity. One thing you'll notice is that this lady is wearing a beautiful necklace, and this necklace is suspiciously looking like lymph nodes. Now you must ask your patient about lymphadenopathy, and if they're positive with the melena, better go for carcinoma. You know that this lady is also holding a can of Pepsi? Now that's for dyspepsia. If there's melena and dyspepsia, that is peptic ulcer. That's enough for the advocate. Until now, we haven't found anything, so we just move to the machine. Now we move to the second terminal of the machine that represents diarrhea. Now, if we really talk about the diarrhea, it's just increase in the frequency or the fluidity of the stools. So as you know that the diarrhea can be in different flavors. So first of all, we're going to represent the bloody diarrhea with these red colors, followed by a viral diarrhea or the watery diarrhea with the blue colors, and finally the diarrhea with the mucus or pus with the white color. Now there are really different causes of the diarrhea. For example, it could be infectious diarrhea by the protozoa, bacteria, or the virus. It can be associated with the IBS or IBD or just endocrine disorders, for example, Addison's disease, hypothyroidism, diabetes, in which we call it diabetic diarrhea, or just tumors, for example, villus adenoma, colorectal carcinoma, or carcinoid tumors. And then there are some drugs, for example, antibiotics, antacids, magnesiums, laxatives, or some just antihypertensive drugs or just cholinergic drugs. Then there's some miscellaneous diarrhea, for example, traveler's diarrhea, diverticulitis, roundworm, tapeworm, hookworm, just worm infestation, or some psychogenic diarrhea. Next thing, you're going to ask about duration and cause. If it's gradual, that's because of malabsorption syndrome, endocrine diseases, or just IBS. If it's with acute onset and settles in a few days, that's because of viral gastroenteritis, bacillary dysentery, or amoebic dysentery. It can also be food poisoning or traveler's diarrhea. And now, if it's with acute onset and long course, that's because of ulcerative colitis, Crohn's disease, or just diverticulitis. Now, one thing you'll realize is that the second terminal is having a beautiful pattern: red, blue, yellow, white. Red, blue, yellow, white. So this pattern is here to remind you of that you're going to ask your patient about the pattern of the diarrhea. So what is the pattern of diarrhea? If it's alternating with constipation, that could be because of IBS or excessive use of laxatives or carcinoma of colon or diverticulosis or just intestinal TB. On the other hand, if it's continuous, that's because of Crohn's disease, laxatives, or intestinal fistula. If intermittent, go for psychogenic diarrhea or just malabsorption syndrome. Ask about the frequency of stools, character of the stools, in which you're going to ask about the quantity, consistency, and the presence of mucus or pus of blood. Now it's time to learn about the associated symptoms with the diarrhea. So here we draw two different dogs. As you know, one of these dogs is an itchy dog who is just itching, while the other dog is just, struggling with poop. He's just stressed and he's having cramps in his stomach and tenesmus. Yes, so tenesmus, cramping, and stress. So, in a nutshell, one of the dogs is just itching, while the second one is struggling with the poop. So, if there's itch with the diarrhea, that's because of dermatitis hepatiformis. And if there are abdominal cramps that are relieved by defecation, this is small intestinal disease. And if there are abdominal cramps that are persisting even after defecation, this is large intestinal disease. Second thing is tenesmus. Now, it is seen in the inflammatory disease of the bowel. For example, amoebic dysentery or bacillary dysentery, ulcerative colitis, Crohn's disease, and anorectal carcinoma. Third, you'll notice that this dog is struggling a lot with the diarrhea. Now, he is just in a lot of stress. So the stress with the diarrhea is because of the nervous diarrhea. This diarrhea is usually self-limiting and consists of watery stools. Now we just draw family members who have come through a long way to see this machine, and they have come with a personal photographer. Now in this whole scenario, family history is very important. For example, if you find a case where the whole of the family members just hanged out for a picnic or party and all of them got the diarrhea, that's just food poisoning. Now I don't want this family to be a happy family. Let's give every member a single unique disease. Let's start with the kid and we give him rash. So the skin rash with the diarrhea is just going to tell you about ulcerative colitis, Crohn's disease, or just dermatitis hepatiformis. So that was all about the first child. What about the daddy? Let's give daddy some arthritis and a brand new shirt from the Edisons. Or just in simple words, if you just come across joint pains with the diarrhea, better think of ulcerative colitis, Crohn's disease, or just reactive arthritis. Also keep in mind if there's a patient with a darkening of skin and diarrhea, that's Addison's disease. But just as a pro tip, keep this thing in mind that Addison's disease is just not really common, so don't try to put it in the top of your differential list. Okay, so that was about father and son. Like father, like son. What about mommy? We give this mom a beautiful thyroid bow tie. And this purplish thyroid bow tie is going to represent thyrotoxicosis. So if there's a patient with a diarrhea, intolerance to heat, weight loss, increased appetite, and just prominent eyes or swelling in the neck, that's going to be hyperthyroidism. Okay, so one child is left. We're going to give him dry eyes and diabetes. Now, if there are painful red eyes that are seen in ulcerative colitis or Crohn's disease, or if you see the symptoms of polyuria, polydipsia, impotency that's seen in diabetic autonomic neuropathy. Woohoo! All of the family members are now diseased. Now that's satisfying. You see one child with rash, daddy with arthritis and Addison's, mommy with hyperthyroidism, and another child with painful red eyes and diabetes. That's a complete family now. What about the person photographer? Let's give him diseases as well. We start by giving him vomiting. Now, if you see a patient with diarrhea and vomiting, that's viral gastroenteritis or Addison's disease or just IBD. One more thing you're going to learn about this photographer is he's wearing a flame bandana, which is going to tell you about fever. So if you just come across fever and diarrhea, that's because of viral gastroenteritis, bacillary dysentery, intestinal TB, or IBD. Or it could be just pseudomembranous colitis. In simple words, it's just infectious diarrhea. And to add more to the scene, we draw some wheat crops. Our advocate was shot dead and was thrown into these fields of crops. Now, these crops are here to remind you of that wheat products can also cause diarrhea in celiac disease, or if they are just milk products, it is just lactase deficiency. Now, that's actually a malabsorption syndrome, and you'll find weight loss and increased appetite, bone pains, pigmentation, pallor, and almost everything is wrong with the patient. Also, if you see a patient with the diarrhea, must ask about the weight loss. If there is weight loss with the increased appetite, that is because of hyperthyroidism or just malabsorption syndrome. If there is significant weight loss followed by diarrhea, can be carcinoma or tuberculosis or diabetes or hyperthyroidism or just malabsorption syndrome. If there's no weight loss and there's a long course diarrhea, it's just IBS or psychogenic diarrhea. Next we draw sun and moon. Now we're going to share the moon with that gorilla or Gohan or just ape or monkey, whatever he is, we're just going to share his moon. So the sun and moon are here to remind you of the diurnal variation. Ask your patient about it. If there's no variation, it's just infectious disease. If it's present in the morning after meal, that's because of gastric disorders or just psychogenic diarrhea it is. Also, morning diarrhea is seen in ulcerative colitis and Crohn's disease. And if there is nocturnal diarrhea, that is because of organic cause. And finally, before we wind up our second output terminal, don't forget to ask your patient about blood or fats or greasy, bulky, frothy stools. Now, this could be blood or malabsorption syndrome. So that was really about diarrhea. As a quick recap, now in this, you're going to ask your patient if there's blood, water, or bulky greasy stools that are hard to flush or just there is pus. Then ask about the pattern of diarrhea, which is just followed by other symptoms, for example, tenesmus, cramps, stress, itch, rash, weight loss, joint pains, red eyes, itch, or just diabetes, thyroid, Addison's disease. Ask about the family history. Ask about intolerance to milk or wheat products. Ask if there's blood or just fats in the stool. Also ask about fever and vomiting. Now let's really move to the final and third output terminal, and there's absolutely nothing. So if there's nothing, it means it's constipation. But wait. If you just focus in this terminal, you will find some of little blood. Either there's nothing, or if you find something, it's going to be blood. So if there's fresh blood in the stool, this is known as hematochezia, and it's seen in ulcerative colitis, Crohn's disease, hemorrhoids, or just colorectal carcinoma. Now, there are a lot of causes for the constipation, for example, lack of physical activity, low diet, nothing per oral. You really need to exclude that NPO. Besides these, the other causes include drug-induced constipation, for example, diuretics, antidepressants, aluminum-containing antacids, laxatives, some psychiatric problems, for example, anxiety and depression. They can give you constipation as well. IBS, systemic diseases, for example, diabetes, hypothyroidism, and pregnancy. And besides these all, there are other causes, for example, chronic amoebiasis, IBD, diverticulitis, or just the tumors of rectum and colon. So now it's really been a very long lecture on constipation. Let's move on to the associated symptom. First of all, we draw this beautiful baby panda here, and this cute baby panda is here to remind you of the physical activity. Just like pandas do nothing at all and they just eat and sleep all the time, so they have a poor physical activity. So if there's a patient with constipation, ask about physical inactivity, improper eating habits, poor bowel habits, inadequate fluid intake, and so and so. So this is really going to give you a clue about the constipation. Just as expected from a panda, always eating. So this panda is going to eat some sweet candies, not the bamboo this time, sure. Anyway, it's diabetes. So in the diabetes, you get polydipsia, polyuria, polyphagia, there's increased appetite. Also, there are some microvascular complications, for example, retinopathy, blurring of vision, nephropathy, you get the CKD, and neuropathy, in which you get tingling and numbness of the fingers, and also the autonomic neuropathy, in which you're going to get the diabetic diarrhea. Next up, I'm going to draw a beautiful pattern. It's going to tell you about the pattern of constipation and diarrhea. Just ask your patient if there's alteration of diarrhea with the constipation, and if it's so, it can be because of IBS, chronic amoebiasis, IBD, diverticulitis, or just laxative abuse. Next associated symptom is just pregnancy, and you want to keep it at the back of your mind. After the pregnancy, go for vomiting. If there's vomiting with the constipation, that is intestinal obstruction. And now here the question is, what are the other features of intestinal obstruction? That is vomiting, pain in abdomen, abdominal distension, and finally absolute constipation. Now we give this pregnant vomiting lady a beautiful thyroid bow tie. This thyroid bow tie is going to tell you about thyrotoxicosis. And along with pregnancy comes a lot of anxiety and depression. Or you can just say that anxiety and depression can also give you constipation. And finally, we're going to wind up this constipation with this chronic sign. Now, this chronic sign is going to tell you about the chronic diseases, for example, stroke, MI, diabetes, chronic amoebiasis. All these can give you constipation. So that was really all about constipation. And just to revise it, ask about the physical activity, diet, pattern, hematochezia, vomiting, thyrotoxicosis, diabetes, MI, stroke, chronic disease, anxiety, depression, or just pregnancy. So in the output terminals, we have talked about melena, diarrhea, and constipation. What about flatus? If there is inability to pass flatus, there's just abdominal distension. So we draw an air pump that is going to tell you about flatus, which is just besides this distended abdominal tent. Oh my god, that was really tough. I can't believe we're done with the GID and it's finally over. Just to revise this all, you're going to ask the patient about appetite, dysphagia, vomiting, hematemesis, jaundice, dyspepsia, edema, ascites, distended abdomen, and the stool details, which are going to include the diarrhea. It could be bloody diarrhea, it could be watery diarrhea, it could be with pus, or just malabsorption diarrhea. Then you're going to ask about melena, constipation, and flatus.